For all those of us who have watched with mounting terror as President Trump offers the public a series of his half-baked ideas and hunches on how to handle and treat and cure COVID-19, the solution seems obvious. Follow the science. Trump's detractors have taken up this mantra.
Follow the science. Listen to the experts.
Science, science, science.
We're going to follow the doctors and the scientists.
But what does that mean? After all, it was Dr. Anthony Fauci who initially downplayed the dangers of the coronavirus. On January 26th, he said, "It's a very, very low risk to the United States. It isn't something the American public needs to worry about or be frightened about." A few days later, Health and Human Services Secretary Alex Azar said this:
"The risk of infection for Americans remains low."
To be fair, he was merely reflecting the views of the government's public health officials. At the same time, Trump advisor Peter Navarro, a non-scientist looking at the same data coming out of China, warned in a January 29th memo of the risk of the coronavirus evolving into a full-blown pandemic, imperiling the lives of millions of Americans, and urged aggressive action. It looks like the layman was right and the scientists were wrong. But putting it that way is too simplistic. The reality is that science does not yield one simple answer, especially not with a new phenomenon like the coronavirus. Dr. Fauci came to a reasonable conclusion given the initial evidence. As that evidence changed, he changed his mind. We tend to think of science as providing one definitive answer to a question, but that isn't really how it works. Science is above all a method of inquiry, the posing of questions and the rigorous testing of these hypotheses against data. With new and better data, we should arrive at new and better conclusions. Now, there are certain fields of study, climate change for instance, where scientists have researched the topic for decades, collected mountains of data, published thousands of peer-reviewed studies, and arrived at a consensus. COVID-19 is entirely different. It's a phenomenon that is barely 4 months old, with little definitive research. In an excellent piece about the pandemic posted last week, Bill Gates had a whole section on a number of key things we still don't understand, and these are central to fashioning the right response. One example: why do young people tend to do so much better with the disease? The answer, after all, would help us to decide how soon and under what conditions to reopen schools. Other questions: which activities make infections more likely? Does weather affect the virus's spread? Keep in mind that we do not have accurate numbers for the virus's rates of infection or spread or death. As we go through the process of locking down and now opening up, scientists around the world are gathering data at a furious pace. We should welcome this and use it to refine, even reverse views about the pandemic. We should welcome those who have heterodox approaches. T.J. Rogers, the founding CEO of Cypress Semiconductors, ran an analysis of the available data that led him to conclude that the speed with which cities locked down had little appreciable effect on lowering the death rate from COVID-19. Now, it's a fairly crude model, but it's still worth looking at. It suggests, for example, that high population density is 8 times more likely to correlate with a high death rate than a late lockdown is. This might explain why densely populated cities like New York, with crowded public transportation networks, have been hit so hard, and why a state like Florida, despite waiting longer to lock down, has had relatively few deaths. And while it always makes sense to be cautious and plan for the worst, there are real costs to the precautionary principle. By canceling non-emergency medical procedures in anticipation of COVID-19 patients, hospitals denied care to many sick people who got much worse as a result, even though it turned out many facilities had the capacity to care for both. Balancing such costs and benefits is ultimately not just about health. If we lowered the speed limit everywhere to 35 miles an hour, we would surely save lives. Yet we try to strike a balance between costs and benefits. Donald Trump's willful ignorance makes us all want to hand the country over to Dr. Fauci. But that is the wrong response. We need leaders who take responsibility and make choices informed deeply by science, but also by economics, politics, ethics, and other disciplines. Just as war is too important to be left to the generals, pandemics are too important to be left just to the scientists. For more, go to cnn.com/Fareed and read my Washington Post column this week.